Good morning, guys. What's up? My name is Dr. Rachel Moore. Sorry about the brief delay this morning. Me and YouTube were apparently not getting along and it wasn't going live. But I am now here today and I'm here to chat with you guys about the planned cesarean delivery. So what do we do or how can we set ourselves up to help people that are opting for a cesarean delivery rather than maybe having a trial of labor or planning for a vaginal delivery? The reason I wanted to dive into this morning actually comes from a scenario that I had with a patient recently who opted for a cesarean delivery. Her provider gave her a couple of options and she was like, yeah, for sure. I want a cesarean. This is the route I want to go. It's how I had wrapped my head around delivering my baby anyway. And she confided in me during our session that she felt a lot of judgment from other people when she talked about that. And so she just kind of stopped telling people that she chose her cesarean delivery when she was presented with a couple of options. And I think that that's a really unfortunate thing to happen because when we think about birth, we know that birth is very complex. And there are so many different factors to it, so many reasons why somebody might have the delivery that they have. And it is unfortunate for somebody to feel any degree of shame around the way that they chose or they happen to deliver their baby. So, for those folks who know that they're having a cesarean delivery, how can we as pelvic PTs set ourselves up to help them get ready for that and set them up for the best possible scenario? Cesarean deliveries are fairly common, especially in the United States. In 2022, 32% of deliveries were cesarean deliveries. So that's about 1 in 3 babies. Cesarean sections are considered to be the safest surgery in the United States and the most common surgical procedure. Obviously, 1 in 3 babies, if we think about how many babies are being born, they're happening very, very frequently. So this is something that we're seeing quite a bit happen. There are a lot of reasons somebody might choose to have a cesarean delivery on the front end. This is the one time in this podcast I'm going to read off this list to you. So, some of the reasons somebody may opt for a planned cesarean is going to be a planned or a previous cesarean delivery. This is not an automatic, yes, for sure you're getting it. But sometimes, if somebody has had a trial of labor that resulted in an emergent cesarean, they may opt for a cesarean delivery up front instead of going through labor, having to recover from having labored, maybe even having pushed, and then still ending up with a cesarean delivery. So sometimes that can be almost a redemptive experience for people to kind of take ownership back from a delivery that they'd had previously that did not go the way that they had originally planned. Pelvic deformities. So that can be any type of deformity. That can be the anatomical structure. Everybody's anatomy varies slightly different, or that can be histories of fractures. Previous perineal trauma, I'm not thinking like grade 1 tears here, but if somebody had a grade 4, that might be an indication that they may opt for a cesarean delivery instead. Prior pelvic or anorectal surgery, active herpes or HIV, so not wanting baby to pass through the vaginal canal for any reason that may transmit something to the baby in the process of delivery. Cardiac or pulmonary disease may also be a reason. Having a cerebral aneurysm, wanting to decrease that intracranial pressure that may come up during a vaginal delivery. Abnormal placentation, so that might be placenta previa, where the placenta is sitting right on top of the cervix and would put baby in an unhealthy or risky situation if the placenta was delivered first via vaginal delivery. An umbilical prolapse, where the umbilical cord is prolapsed, or same thing as the placenta blocking the cervix, but the umbilical cord is there. So it might come out before baby and again, put baby at risk of not delivering or not receiving the oxygen and the blood flow from mom. Positioning of the baby. Y'all know I've talked about this so much. I had a breech baby and opted for an ECV and was able to do a vaginal delivery. But some people might not want to go through the process of an ECV. It is a long process. It's a lot to kind of mentally prepare yourself for. You do the process. It's another procedure that you have to have. Some people may say, I would rather just get the one procedure and be done and choose for a delivery if their baby is in a non-optimal position for a vaginal delivery. Macrosomia, so large baby, and then honestly, maternal request. There are, ACOG has a position statement on this. Actually, if you're interested, I recommend Googling it and reading through it. But sometimes moms just want to have a cesarean delivery for whatever reason. Maybe it's fear-based, maybe it's cultural. And their ACOG has some recommendations on some ways to kind of screen for if somebody should be recommended to have a vaginal delivery or have the cesarean delivery solely based on maternal request. At the end of the day, this is that person's birth story and that person's birth journey. And so we need to be able to meet them where they're at, respect and honor what their wishes are, and help them the same way we would help somebody who's preparing for a vaginal delivery. The birth prep side of it looks a little bit different because we're not worrying about learn how to relax your pelvic floor, learn how to push while you are in the presence of discomfort or things like that. But there's still so much we could do to help set these women up for success. There's a lot of stigma here, right? We see these big pendulum swings. There's so many people online that are like, oh my gosh, never have cesarean. The US is terrible for having so many cesarean rates. Then there are physicians that we see who are like, I got a vacation. We're going to go ahead and do a cesarean section and just plan it and put it on the schedule. So we see both sides of this, right? We see it culturally, we see it everywhere. And again, it's up to us to help kind of hold that line of whatever you choose, whatever you opt for, I'm here to support you. And honestly, they may need you to be there to help them kind of see that it's okay and it's not a failure to opt for a cesarean delivery. If somebody maybe was planning on having a vaginal delivery and then found out that they have placenta previa and now they have to have a cesarean delivery, talking through everything with them, guiding them in this process and helping them wrap their head around it and then physically get ready too can be such a big piece in helping them get to the place where they're more comfortable with or accepting the fact that they're going to be having this cesarean delivery. So when we think about ways that we can help people prepare, we're going to divide this up into physical and mental. So from a physical standpoint, we can prehab somebody who is planning on having a cesarean delivery. So think about our ACL surgeries, right? Sometimes people know that they're going to have an ACL surgery, maybe a month or two down the line. It's not, oh, we'll just lay in bed and do nothing with your leg. It's let's get your leg, your hip, your quad, your hamstring as strong as we possibly can so that when you have this surgery and we have this deconditioning that occurs as a process of that stress cascade that happens and in taking the time off, our reserve that we're going into that experience with is significantly higher. Same thing with the cesarean delivery. We can build somebody's capacity during pregnancy so that when they have this delivery and they're deconditioning and they're in the bed a little bit more than they were before, they aren't seeing this significant fall off in their functional capacity because they had such a high reserve. When we're thinking about things that we're going to focus in on, number one is going to be core strength. So getting that core nice and strong so that when we have the delivery, that core is interrupted and is healing from that. There is a higher baseline level of strength in those tissues themselves. And then when we think about this, we're not just going to stop at the core. We also want to think about the other things that the person may need to be strong, right? So when somebody has an abdominal surgery, they're relying on their arms and their upper body a lot more to help pull them up or push them up when they're going to do different activities. So upper body strengthening is so important in this population, especially if you're seeing people who aren't already strength training. Maybe their upper body is really weak and they need some degree of strengthening layered in so that they have the capacity to lift their own bodies up. We also need to build hip strength. The hips are right next to that abdominal region and that core. So increasing our hip strength, maybe then we don't have to use our hands to press to sit up out of a chair because we can rely on our nice, strong legs to help do that for us. We also can help people by setting the stage. What I mean by this is setting ourselves up for success in the most ways that we possibly can, given what we know about what happens post cesarean delivery. So, after delivery, people are often told don't lift anything more than 5 pounds, and most people's babies weigh more than 5 pounds. They're limited in their ability to bend, lift, and twist. And so, with those considerations on board, how can we set things up so that mom can function as optimal as possible while she is recovering and while she is also taking care of an entire new human? When I think about this, one of the biggest ways I'm thinking about is her sleeping situation. So when we go from supine laying in a bed to sitting up in the middle of the night to get baby to nurse to do all the things, that can be a lot of core demand. And we may not necessarily think like log roll over, gently press up in the middle of the night when we're getting up for the third time. So maybe we talk to mom about purchasing a wedge pillow that allows her to sleep at more of an incline so that when she goes to sit up, there's less demand on the core. She's able to get up a little bit easier. Maybe we even get one of those temporary grab bars for the side of the bed so that as she's doing that sit up, she can use her upper body to help pull and assist in that sit up position. If we're thinking about baby supplies, getting a bassinet that has an adjustable height can be really helpful in this scenario. We can minimize the bending down quite as much and having to lift quite as much. If we have a bassinet that's adjustable, we can set it up higher, especially in that earlier timeline when mom is still recovering. And if we know that we're having a cesarean delivery on the front end, we can choose the bassinet that has that function rather than not knowing and being stuck or having to buy a second bassinet that they cannot then adjust. There are also bassinets that have a little like zipper side where you can raise it up to the height of the bed and unzip the side so that it's kind of like a open, easy ability for mom to get baby and slide baby rather than picking up. So both of those functions can be incredibly helpful in considering a bassinet if we know that we're having a planned cesarean delivery. The other thing that we can think about is setting up stations for mom in different areas of the house. So maybe it is a lot of work to get up and down out of bed over and over and over. We know she's going to lay in bed to go to sleep, but we want to minimize that demand throughout the rest of her day. Maybe we set up a station in the living room that has a chair or a couch that's easier to get up off of. And when I mean setting up stations is having a table next to it that she can set stuff on, having her breastfeeding supplies set up on the side there so she's not having to get up and walk around, having a snack bin set up right next to it so that it's easy for her to grab something to do some quick fueling, setting a phone charger or plugging in a phone charger close by, setting up a Kindle so that she has something to read. So all of these different things that we can do to set mom up for success when she is in a different region or different area of the house outside of her bedroom and her bed so that she can move around a little bit easier and function a little bit smoother. The other thing that we can do from a setting the stage standpoint, if this is not first baby, if we know we're having a cesarean delivery, we can set up assistance with the older kiddos or even assistance with baby on the forefront. So maybe that looks like hiring a postpartum doula to come in and help with baby care activities throughout the day. Or maybe that looks like arranging for family to come in town or sending older kiddos off with grandparents for a week for a fun little trip. Lots of different options here, but knowing that this is going to happen, knowing that we're not only adjusting and adapting to baby, but we're also recovering from a major abdominal surgery, we can bring on the support that we need ahead of time rather than feeling like we're scrambling to try to find that support after. We also can provide so much education. We know that scar tissue massage is important, and it is insane how rarely it's actually taught to people post cesarean delivery. They don't know when they're supposed to do it, they don't know why they're supposed to do it, and they have no clue how they're supposed to do it. So we can talk about this on the forefront. Hey, in those first couple weeks, I don't really want you touching that scar directly or that incision because you're going to have stitches, but maybe we start up in the upper abdomen and below the incision, just working on desensitizing that tissue. So applying some pressure, using different types of fabrics to rub across that anterior abdominal wall to help the nervous system regulate and not fall into this hypersensitive side as it continues to heal. Once your incision is closed, we see that your stitches are gone. We can start getting closer and closer till we're on top of that incision. And this is how we do that cesarean scar massage. So teaching them up front how to do it, when to do it, not just necessarily at 2 weeks do this, but based on your body and your healing times, this is what we're looking for. And this is when you move on. And this is why we're doing it. On that same front, when we're thinking about healing times and promoting healing and facilitating healing, talking to people about nutrition on the forefront. And I'm not just talking about for after the surgery, I'm talking about for before the surgery as well. We know that when we have surgery, we have an inflammatory cascade that happens that affects our nervous system, our immune system, and our ability for our body to heal. And fueling appropriately with protein can help mitigate this. Protein is the building block. It helps our body as a whole repair and restore after insults or traumas. And surgery, in and of itself, is a controlled trauma. So, discussing the importance of protein ahead of surgery, the few weeks leading up to that planned delivery, as well as after surgery, so that she's got enough things in her body to help promote healing and give her body the most that it possibly can have in order to optimize that recovery. As far as mentally preparing for a cesarean, sometimes this is the absolute opposite way of how somebody envisioned giving birth. And knowing ahead of time that it's coming can give somebody the time to process and plan so that they're not coming to terms with this 30 minutes or an hour or 2 days before their baby is born, but they have some time to really process it. For our people who struggle with maybe anxiety or mental health in general, and they need a little bit more support and a little bit more time to kind of cope through with this process and work through this process, this is a really great option to know that this is coming, be able to get in with a mental health care professional on the forefront to discuss their feelings around this and go into their delivery with the best tools for their surgery itself and for afterwards that they possibly can. We're also empowering people in this space. A birth is a birth. You are transformed when you deliver a human. It doesn't matter how that human is delivered. It is a very surreal experience. It is an amazing experience. And it is something that is important and valuable to you and your journey, regardless of the way baby is born. And so I think sometimes taking the stigma away and reminding people of that, like you still birthed a human, you still had a birth. And it might not have been a vaginal delivery, and that is completely okay. It doesn't make you any less of a mother or any less of a person for having opted for that reason compared to trying for a labor of vaginal deliveries or not. I think sometimes we can come into this space with some biases, right? Especially those of us that are in the more like holistic minded world where we're kind of moving away from surgeries. Obviously, as PTs, we never are like, yeah, for sure, go get that surgery right out the gate. We want to do all the things we can from a conservative management standpoint first. And I'm not saying we should completely throw that out in this scenario. But at the end of the day, we have to respect somebody's wishes and we need to be able to meet them where they're at and help them process through this and get themselves set up in the best possible way that they can in order to have more a happier and healthier postpartum recovery. I hope you guys took something away from today. This was honestly a bias check for me because I work in birth centers. I work with women who are prepping for vaginal deliveries unmedicated all the time. And that's fantastic if that's the journey you choose. But it's also fantastic if it's not the journey you choose to. Thank you guys for joining me this morning. I would love to see you guys out on the road. We are not doing any pelvic live courses in February, but we've got 2 coming up in March. So head to the website, sign up for those courses if you want to come join us on the road to learn about all things pelvic, dive into that standing exam, get into some labs, learn some ways to teach people how to move pregnant, postpartum, or with pelvic concerns. And if you're interested in our L1 and L2 online cohorts, we are in week 3 of those right now. But we'll be rolling out that next one soon. So in 5 weeks, 6 weeks actually. So head to the website, sign up for those courses if you want to learn more about pelvic. And I hope you guys have an awesome Monday and crush it out there. Thanks. Bye.